Okay, so hi Rosina,
Hi, Miss Ronica.
how are you doing today?
I am hanging in there. How are you?
I'm good. Okay, so this session we will be, I will be taking your biopsychosocial assessment. That is basically me asking you a bunch of questions and you replying to me about them, like your psychiatric history or your medical history. Sounds okay?
Sounds good.
And I also wanted to tell you that I am a mandated reporter. So if I find any incidences of self harm or child and elder abuse, I will be mandated to report that. Is that okay?
Okay, that's fine.
So tell me, what brings you in here today?
There's been a number of things going on. Um, the COVID-19 pandemic is out. I'm a tier 2 essential worker.
Mm-hmm.
So I've been having some anxiety about that, still going to work, but we just never know when we'd have to shut down. Um, so there are a lot of anxiety going on with that. Feeling a little bit depressed,
Okay.
um, because I just still going to work and then seeing a lot of the things that are going on in the world and being concerned about that. And um, I was going to get my mom, and I actually picked her up and brought her home because she's 71 and I want to make sure she's okay. But with me working every day still, and oops, what happened?
Now I can hear you.
um with me still going to work, and um I lost your picture. I'm glad you can still hear me.
It's fine, just keep going.
um there it is, there we go. um I'm just a little bit worried about taking care of her and her being exposed, things like that. So, and work, and still being able to pay my bills, things like that.
Mm-hmm. All right then. So I will also, so I'm going to ask you, it's like a current symptom check. So I'll be asking you a bunch of symptoms and you can tell me if they are applicable to you or not.
Okay,
Does that sound okay?
yeah, that's fine.
Okay, so are you been having aggressive behaviors lately?
No.
What about agitation or any of the anorexia or appetite disturbances?
No. Mm-mm.
Uh, what about, no to binging as well, correct?
No.
So what about circumstantial symptoms? Have you had any circumstantial symptoms like insomnia or something like that?
A little bit of night terrors, a little. I had a car accident back here not too long ago, and I still like have those kind of bad dreams about that and
So how
everything.
many years ago was the car accident?
Maybe a little over a year ago.
Okay. And so you're saying you have night terrors. So you do have insomnia or do you not have insomnia?
I'm still able to sleep. It's just that, I still have the bad dreams.
Uh-huh. Okay. And how would you rate that? Like, is it mild to moderate?
Yeah, I'm about a mild to moderate.
Mhm. Do you have any other medical conditions?
No.
Okay. And like hypertension or something like that?
Um,
Diabetes, hypertension?
the hypertension I had a while back ago, but nothing that is existing at this moment.
Mm-hmm. Conduct disorders, delusions, depressed mood.
Mm, just a little bit of the depression, a little bit, I would say mild to moderate.
What about dissociative states? So do you feel like do you have two states of mind or something like that?
Oh, no. Mm-mm.
You did say you have depressed mood, so elevated mood wouldn't be an option, correct?
No.
What about elimination disturbances?
No.
Have you been subjected to any trauma or have you subjected anybody to any trauma?
No.
How would you rate your emotionality? So, how emotional are you as a person?
Um, I'm sensitive, but I wouldn't say I'm like a very emotional person.
So mild.
Mild.
You do have fatigue, correct?
Hmm.
So, will you rate that as mild or moderate?
Between mild and moderate.
Okay. Generalized anxiety, you did say that is. So, would you rate that as a moderate?
Yes.
What about grief?
No, no grief.
Guilt?
Mm-mm. No,
Hallucinations?
no,
Hopelessness or hyperactivity or irritability? Any of those?
no,
That's good to hear. Have you been taking any medications like laxatives or diuretics?
no.
Have you had any loose associations like, things coming into your mind all of a sudden?
Like racing thoughts or anything?
Yeah,
No,
racing thoughts.
no,
Mood swings,
no,
obsessions and compulsions,
no,
oppositional behavior, panic attacks, paranoid ideations,
no,
any phobias?
no,
Were you a physical trauma perpetrator?
no. Mm-mm.
But you did say that you were in a car accident, correct?
That's correct.
And so would you rate that car accident as moderate?
Yes.
How was your concentration? Do you have poor concentration?
No.
So that's pretty good.
Yes.
And how are your grooming skills?
Oh yeah, I shower and everything every day.
Okay. Psychomotor retardation. So do you have any motor problems?
No.
Any self-mutilation cases?
Oh no.
Sexual dysfunctioning or sexual trauma perpetrator or victim?
No.
Significant weight gain or loss?
No. I'm kind of plateaued there.
Okay. Sleep disturbance. You did say you have a bit of insomnia, correct?
Yes, a little insomnia and the bad dreams.
So would you rate that as a mild to moderate?
Yes.
Have you tried anything for those, like to give you some relief at some point in time?
No.
How was your social isolation? Do you socially isolate yourself?
No. I'm a social butterfly. Get out there with everybody.
What about somatic complaints?
Mm-mm.
Have you ever had substance abuse?
No. No drugs, no alcohol.
Good. And worthlessness?
No.
Feelings of worthlessness? Any other symptoms that you can think about that could be of use to me?
None that I can think of. No.
Okay. So now we're going into your emotional or psychiatric history. So have
Okay.
you ever been prior outpatient psychotherapeutic? Have you ever taken any outpatient psychotherapy?
No.
All right. And has any of your family member done that as well?
No.
Okay. So no outpatient. What about inpatient?
No. Mm-mm.
None for that as well. All
No.
right. Have you ever taken any psychotropic medications?
No.
All right. And your family?
No.
All right. So I'll be going into family history now.
Okay.
So I need to know, was your mom and dad present throughout your childhood?
Yes, they were married and I raised me in the household, myself and my older brother.
All right. And any other significant family members who you can think of, like sister or anybody else?
I have a god sister. her and I are extremely close even now. My brother is deceased.
All right, I'm so sorry to hear that. How long has he been passed away?
It'll be 2 years this year.
2 years. And could you tell me your names of your father and mother?
My mother's name is Emma, Emma,
Mm-hmm.
middle initial L.
Middle
Last
initial
name was
is?
Campbell. L as in Larry.
Okay. And your father's name?
His name was Willie, Willie,
Okay.
middle initial E.
And what was their occupation?
My father was a factory worker
Okay.
and my mother was a housewife.
Okay. And their education?
Um, they really didn't have, I would say that my father was maybe second grade,
Mm-hmm.
although he went to the Navy when we think he was 17, but he might have been younger.
Okay.
Um, and
And
my mother was like fourth grade.
17 or younger. And how was their general health?
It was pretty good throughout my childhood.
Mm-hmm. And so there was no any general health of your parents, I'm saying.
Oh, my parents. My father, he had tuberculosis when he was in the military, when he was in the Navy.
Okay.
So he had some issues with like his breathing.
Did he have like bronchitis?
Um, it was more like COPD. We
Okay.
now know that's what it's now identified as. And my mother, she died from ovarian cancer.
Okay. All right. And would you describe your childhood family experience, like an outstanding home environment or a normal home environment or a chaotic home environment?
Um, it was a
Normal?
good home environment. It was stable. It was normal.
And your parents were married to each other, correct?
Correct.
And how long has it been since your mother deceased?
She died in 2001. So
So 20 years?
19, 20 years now. And
And
my
what,
dad died in 2003.
so that would be 17, 18 years.
Mhm.
And
To
uh,
today, this is the anniversary date of his passing.
I'm really sorry to hear that. So what was your age when your father died?
I was 33 when he passed, and I was 31 when my mother passed.
Okay. And what was your age of emancipation from home?
18. I
And
went to college.
which college?
Rock Valley Technical College in Rockford, Illinois.
And what were you studying there?
Business administration.
And were there any special circumstances in your childhood that you can think of?
No,
All right. Immediate family. So are you single, married, divorced?
I'm divorced. I've been divorced now for 15 years. I have
Okay.
2 children, one
Mm-hmm.
from marriage, one outside of the marriage. My oldest is within the marriage. She's my junior. Her name is Rosina, and middle initial is L.
Okay.
She's 30.
And your son's name?
My son name is David,
Mm-hmm.
middle initial D. His last name is McAllister. That's Mcalister, and he's 23.
Is there single L or double L?
1L.
Okay. And I wanted to ask you, so your intimate relationship, are you currently in a relationship?
No.
All right. And your relationship satisfaction. So when you were in one, were you like satisfied or somewhat satisfied with it? Somewhat or dissatisfied with the relationship at all?
It was okay. It was somewhat satisfied. Yeah.
All right. You do live alone currently, right?
My godmother lives with me right now.
Okay. And what is your godmother's name?
Her name is Novertia, Novertia. Last name is Buckingham, just like Buckingham
Buckingham
Palace.
Palace. So Novardia Buckingham. And how old is she?
She just turned 71.
Oh, congratulations to her. And she's a godmother, correct?
Correct. She's just, well, that's my second mom, so I don't know. I think that she's just like having my mom here.
Does she shout at you when you do not listen to her?
Yes,
That's your mom, all right.
absolutely.
How often do your children visit you? So your daughter and your
All the
son?
time. My daughter and I actually work together at the group home that I manage. She's a part-time worker there. So I see her quite often. My son, I see about once a week.
Okay.
And when I don't like, physically see him, he'll video chat me because he works at the House of Corrections.
Okay. And so describe how was your past or current significant issues in your intimate relationship. So how was your marriage?
My husband was a cheater.
Okay.
So yeah, our relationship was,
So did you have any trust issues because of it?
oh yeah, well, I couldn't trust him because he was just, um the old fashioned word used to be he was a philanderer.
Uh-huh.
But he got around. um he was a good guy. We went to high school together,
Uh-huh.
and really, I think we got married more so for the convenience of things. I was ready to leave home. He had already left home. He was in the military.
Okay.
We were really good friends, and we ended up getting married. It wasn't the best idea in the world. We were still young too. So, yeah. But
So
at the end
how
of the day,
old were you when you got married?
21.
Ah, okay. And do you have any past or significant issues within the family? Like, were you burdened with responsibility or something like that?
I had the responsibility of taking care of things because my mother and father, they didn't have, um, they weren't very well educated.
Mhm.
So I was responsible for helping to take care of the bills and do a lot of communicating with um, the people that, bill collectors, things like that. I was responsible for that. When my father got sick, I was in high school. So I was responsible for filling out a lot of his disability paperwork, getting that off the ground, speaking with the lawyers, um, and communicating with all of the other people that were significant to his case, taking statements. So I had a lot of responsibility on me. And at the same time, my brother had 4 children.
Okay.
So him and his wife, they both worked. So I also took care of them. I would actually babysit a lot, see to it that they got off to school, things like that. Make sure they had their homework done. While my brother and his wife, they worked a lot. One worked at the hospital, and my brother was also a factory worker.
How would you, now I'm coming into your medical history. So
Okay.
how would you describe your current physical health? Is it good? Is it fair? Is it poor?
Mm, it's fair. I do have arthritis
Mhm.
um, in my knees. I have the psoriatic arthritis
So
in
is it in both the knees or is it just in the one side?
primarily in the left.
Okay.
Left
And you
is
did
developing
say,
right.
mhm. So is it, do you take any medications for it?
No, 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 no. I just try to stay physically active as much
Mhm.
as possible. Um,
And
if I do have
hi.
any significant pain of any kind, I usually take something over the counter like some ibuprofen or acetaminophen.
Okay, like naproxen?
Yes.
Okay, and what would you take it like once a day or two times a day or something like that?
Maybe once a week,
Oh,
maybe. It's only if I really need it.
okay. And you did say that you had a case of mild hypertension, which is under control, right?
Yes,
And you did say your mom has ovarian cancer. So do you like go for yearly checkups because of that?
I do. I because of that history, I have annuals that I do, and because of the age that I am right now, do like everything for me in preventative care. I also do
Mhm.
the mammograms. I
Right,
do the uh, the check for the pap and pelvic. I get those done. And they do like a small biopsy in order to make sure that there's no cells there that will potentially be cancerous. So I do
right.
that every year. So, and my preventative care has always been, like clockwork every year, and there's nothing that has come up.
That's good. Uh, so you do your animal physical every year, correct?
Correct. As a matter of fact, it's coming up very soon.
Yep. Um, what was your name of your primary care physician?
I do. My current one is Dr. Sharma,
Okay.
Shrma.
And do you know her phone number, please?
Yes, it's 414-319
Mm-hmm.
2000.
Okay. Do you have any psychiatrist that you have ever visited?
No,
Mm-hmm. Are there any known allergies? Do you
no,
have any known allergies?
no.
Okay. So I'll be going into a history of your family. So you did say your father had TB, correct?
Correct.
Any birth defects or emotional problems in your
No,
family?
no,
Behavioral problems?
no,
Thyroid?
no,
Cancer, you said your mom had one. What about mental retardation?
no.
Heart disease?
No, not that I know of.
Okay, high blood pressure?
I had the hypertension. My father did have some issues with his blood pressure.
Okay. Alcoholism or drug abuse?
No,
Diabetes?
no. Oh, my brother did have diabetes.
Okay. Alzheimer's disease or dementia?
No,
Stroke?
no.
So, any other serious health problems with your dad or mom,
No.
like gout or psoriasis or
Dad did.
lupus?
He had a bout with gout for a time. Yes, he did.
Okay. Do you have any serious hospitalizations or accidents? So, you did say you have an accident, right?
Yes, but I wasn't hospitalized for it.
So, what
Um, I was
year was that?
hospitalized.
Sorry?
That was 18, 19, 18, 2000, November
18.
2018.
Oh, November 2018. One second. Um, so your age was what, 52?
50. Oh, I'll be 55 next week. Yay.
Yeah. Your birthday is on
April
April
8th,
8th, right?
correct.
So you were 53 that time then. And
55.
no, I meant during the time of your accident.
Oh, yes, I was 53. Yes, ma'am.
The reason was a car accident. Okay, any list of any abnormal lab test results did you ever receive?
No.
Okay, so you did say you did not use any substances, correct?
Oh no.
So this doesn't apply to you at all. And any you do not take any prescription drugs too, right?
No, just regular vitamins, the daily multivitamins for women and vitamin D3.
Oh, okay. So that would be vitamin D3. And do you have any idea how what's the dose of it?
I'm sorry, hon, say it again.
Do you have any idea what's the dosage
For the
of the,
vitamin D,
yeah, vitamin D3?
I take 50 milligrams, so 100 milligrams a day.
Milligrams twice a day.
Yes.
And you
That's
do
because
take,
we don't have a lot of sunshine here in Wisconsin. It's cloudy all the doggone time.
Yup, it is. Do you, how is your vitamin C intake currently?
Vitamin C is good.
Because it kind of helps to fight COVID with
Mhm.
vitamin C and zinc.
And I take the elderberry too.
Ah, yeah, those have helped. Um, all right. Substance abuse of your family as well. So, did they have any issues with substances?
No.
All right. Developmental history. Were there any problems during your mother's pregnancy with you?
No, she had a normal pregnancy.
And so it was a normal delivery, correct?
Yes, normal vaginal delivery. I was 7 pounds 6 ounces.
Okay. And uh, infancy problems. So, did you have any feeding problems, sleep problems, or toilet training problems?
Mm-mm.
None?
Nope.
How was your childhood health? Did you have chicken pox?
Not until I was 11. I was 11 when I had chicken pox.
What about German measles, measles, rheumatic fever, whooping cough?
Mm-mm.
Did you take vaccinations for all of them? Scarlet
Yes,
fever, scarlet fever. You didn't have autism, correct? Ear infections? Any ear infections?
I had one ear infection. I want to say that it was the same time that I had the chicken pox.
Okay. So one ear infections at the age of 11.
Yes.
All right. What about lead poisoning, mumps, diphtheria, polio?
No,
None?
none of those. No,
Pneumonia, TB, asthma,
no,
mental retardation? No, of course. Um, you didn't have any allergies when you were a kid?
no.
And what about significant injuries? Were you hurt, which was very significant?
No.
Injured, like physical? No serious health problems as well, correct?
No.
As a kid? And did you have any delayed developmental milestones like sitting, rolling over, standing, walking?
Nah. My mom said I was getting out of the way pretty fast. So I think I started walking at like about 9, 10 months, maybe 11 months old. I was walking and doing a little bit of babbling, I guess.
So you're an overachiever.
A little.
So did you have any problems with controlling your bladder, controlling bowels, sleeping alone?
Nope.
And how about playing cooperatively or riding a bicycle, tricycle?
All that's normal.
Engaging in your peers, dressing self?
Oh, yeah. I was always organizing something.
So, did you have any behavior problems like you did say no to drug and alcohol abuse, correct?
Oh,
What about chronic lying, stealing, violent temper, fire setting?
I better not.
Hyperactive. Were you hyperactive?
No.
Did you have any? I do not think so, but animal cruelty,
Oh, oh no.
assaults to others, disobedient, repeats words of others. Were you not trustworthy? No, I think you're very trusting of others, aren't you?
Oh, I am. Maybe oh, my kids always have been overly trusting.
And did you ever have an angry mood or like a hostile mood or indecisive?
Does trying to kill my ex-husband? No, I'm joking. I'm joking.
I guess.
No.
No, those are circumstantial. Those are, I think, accepted.
That was strictly circumstantial. It was just one incident, but no.
Did you have any bizarre behavior or self-injurious threats to yourself?
No.
Are you frequently tearful?
No.
A lack of attachment? Are you distrustful of people now?
No.
Okay. Are you an extreme worrier?
No.
Self-injurious acts, again, you said no to them, right? Um, and are you impulsive or easily distracted?
No.
Are you often sad? Do you have poor concentration or do you break things in anger?
No.
Okay. Social interaction. You did say you're a social butterfly, aren't you?
Yes.
So that's a normal social interaction.
Mhm.
And how would you rate your intelligence? Would you say that as normal, high, learning problems?
I say normal.
Okay. And what is your current or highest education level?
I'm right. Well, I already have my bachelor's in theology, and I'm pursuing my master's in mental health counseling at Springfield.
So you have bachelor's in theology, right?
Yes.
And any other developmental problems or issues that you can think of?
No.
I'm going into your socioeconomic history now.
Okay.
So, do you have any? How is your living situation? Is the housing adequate?
Yes. I own my home.
Okay. And social support system. So, do you have a supportive network? Do you have few friends, or do you have? Are you
My
distant from your
church
family?
yeah, my church family, my children, my godmother, my god sister. I have a wonderful support network.
And were you ever in the military?
No, my ex-husband was.
Employment. So, are you employed and satisfied? Employed but dissatisfied?
I am.
That's an iffy thing, right? Satisfaction.
Right now it is only because of this whole essential worker stuff. During the COVID, yeah, I am currently employed, and I mean, it's for the most part, it is very satisfying.
Oh, financial situation. Do you have any current financial problems? Or did you have relationship conflicts over the finances?
No,
Okay, so no current financial problems, right? Legal history. Have you ever been, I have had any legal problems?
almost with my ex. No, no. As you can tell, I'm quite the jokester too. But
Right.
oh, I
Okay.
can't. I can't go to jail, Dr. Veronica. I can't go to jail.
I think they will send you back if you go into jail. They'll be
They
like, we can't take
probably
you.
would. Yes, absolutely.
Okay, I think we are almost towards the end, and I'll be going into your sexual history now. So, do you have heterosexual orientation or homosexual?
Hetero, heterosexual.
And are you currently sexually active?
No.
Uh, Also, what was your first sex experience? Age.
21.
An age of first pregnancy.
25.
Okay. History of promiscuity means that if you have any multiple partners and you're continuously having sex. So is that it? No, right?
Mm-mm. Too much stuff going on out here. Limit all contact.
Okay. And now I'll be going. So you are an African American, right?
Correct.
And what is your religion?
I'm non-denominational.
A Christian, right?
Mhm.
And
Yes.
lastly is like, do you have any cultural issues that contribute to your current problem?
Um,
Like any
I
problems
don't
at
think so.
work because of
Just
your
the stress of
cultural adversity?
sometimes my boss is a piece of work. Sometimes she says things that just are you could tell by the tone where she was, the time frame that she grew up in. Um, she says some things that just will really throw you off. She grew up in the 60s.
Uh-huh.
Yeah, kind of grew up in the 60s at a time when the civil rights movement was going on.
Right.
And some things that she refers to, I'm like, oh, you're still
Okay.
there. Come out of your time, darling.
So is she supportive of your education? How is she taking that?
I think that she's a little concerned only because um, an advanced degree for me would put me in a position where I would be um,
Better than her?
financially. I don't think she would be able to afford really to keep me on. It would be my choice whether or not I would stay. And I think
Okay.
that's giving her some anxiety right now. She is a
Okay.
little bit concerned. She asked me why did I go back to school, and I just was very honest. This is something that I want to do. I want to be able to really help people, and I had to have the degree. I had to have the professional degree in order. I'm already doing the work,
Right.
but I needed the degree to go with that.
Right. So, do you do any like activities to help you? Like, do you think any of your activities that I should think about that could help in the treatment planning? Like, do you do journaling or meditation or
I do.
praying or something like that?
I do a lot of journaling, a lot of studying, meditation, prayer.
Mm-hmm.
Um, I am also a community activist. So I do a lot of community organizing of different programs, especially revolving around youth
Mm-hmm.
for my church because I'm the administrative pastor for our ministry. So a lot of the outreach is revolving, and it's very relaxing to be able to do that kind of thing. You would think that would be stressful, but it's
Mm-hmm.
not. It's actually wonderful being able to help others. So I enjoy that, knowing that I can, interact with others and help them. So that might be
And
helpful as part of the
and
treatment.
so like journaling, all these meditation, and
Oh,
I
yes.
think even these activities with your in the church, do they help you out, like
Oh, yeah.
give you a peace of mind?
Absolutely. Absolutely.
You said you were a community activist, right?
Activist, yes. So I do some things politically. So I work with like the district aldermen. Right now I'm in contact with our state senator. She's running for mayor. So I've worked with her, the mayor, um, just for some of the stop the violence stuff. We have a lot of
Right.
violent things and domestic violence stuff. I do a lot
Right.
of community. So I love doing
And
the behind the scenes things like that.
All right. I think we are almost towards the end.
Okay.
And do you have any hobbies? You did say you love playing games with your community kids, right?
Oh yeah. Oh yeah. Playing chess, um,
Board games?
all kind of board games, cards, things like that. And the journaling, that's also a part of my hobbies. Um, I was doing the yoga for a little bit, but I'm trying to get back into that. Other than that, I still go walking, and um, I like to read. I love to read. Love to read. So those are some of the things I like to do.
All right, then that was the end. Do you have any questions for me?
Mhm. No, ma'am.
So we're done. I will be looking into this assessment and I will see which is the best treatment plan that we can work towards.
Okay.
And I'll let you know. So have a great day, Rosina.
You too.
All right, bye.
Bye.